Hello, I'm Dr. Wade Banner with InMotion Dentist. I wanted to take a couple minutes and just share with you a little bit about my practice and some of the struggles that we have, and also some of the services that we provide. So started InMotion Dentist 10 years ago providing house call dentistry exclusively. About 3 years ago, we got a grant with the San Gabriel Pomona Regional Center to open up a specialty dental office in the city of Laverne. And this office was meant to work with the special needs population, senior, medically compromised. And so we really built in a lot of adaptations to the practice as we built the practice from the ground up with the special needs population in mind. And so some of those included a little bit larger treatment rooms, wheelchair recliners, dimmable lights, just several different features to be able to help those with special needs feel more comfortable with getting dental work done, both from a physical and an intellectually disabled standpoint. Our practice really tries to bridge the gap between patients that struggle to find dental care because dentists have a hard time working with a patient with special needs. They don't have the training to be able to work with somebody with special needs, or a patient can't transfer to the dental chair. Our practice works with an anesthesiologist that brings in an anesthesiologist to provide GA sedation services. And that's a really big benefit for patients that just can't tolerate dental work awake because of their intellectual disability. We work with several different regional centers. We work with behavioral therapists to help with being able to get dental services to patients that have disabilities. And we are also in the middle of training one of our assistants to become a registered behavioral therapist as well, so she can work more closely with the ABA therapists. Our doctors and staff all receive hands-on training of how to work with patients with special needs, how to take x-rays on them, how to keep them calm, stabilize them during treatment. And so that's what we really love, is we all go home at the end of the day with just a lot of gratitude for the services we've been able to provide for this population. Some of the struggles that we have is reimbursement rate. A lot of our patients are special needs that also have Medi-Cal. So not only does it take longer to provide treatment because of their disabilities, but also our reimbursement rate is pretty close to 30 cents on the dollar when you look at the SMA rates of Medi-Cal versus our UCR fees. And so one of the struggles with this is retaining providers, because providers, dentists are often paid on production. Also, the number of staff members that I can hire to help facilitate care is limited as well, because the reimbursement rate is lower, so there's less money to go around to hire the help that we need when additional help is needed to facilitate and coordinate care, such as obtaining medical histories, getting consents when a patient doesn't sign their own consent form. So those are some of the really big issues. We have been fortunate enough to be able to work with some of our regional centers and contracted sites on securing supplemental income. But really what really needs to happen is try to get a higher reimbursement rate for those patients that have Medi-Cal from Medi-Cal. And so one thing that we have been doing to avoid risk with our patients that are medically compromised is going through a series of tests to make sure that they are healthy enough to have dental work. And so that includes medical histories when needed, really having a thorough evaluation of their health history, their list of medications, seeing if any of those medications are going to interact or interfere with the services that we're providing. And then also we run a series of tests from sleep apnea questionnaire, caries risk assessment, saliva test, hemoglobin A1C test, glucose test, blood pressure for a lot of our patients ahead of treatment, to verify that, if we're going to take out a tooth, that they're going to be able to heal properly from that. So anyways, just wanted to share you a little bit about my practice, what we do, the struggles that we have. One of the big struggles is training, finding dentists and providers and hygienists that have training with working with the special needs population. And so there's some minimal training in their programs a lot of times, but getting more exposure to that is definitely challenging. And so we would love to see additional training and support from an incentive standpoint. Say a provider decides to work in a special needs clinic, maybe some government support on their student loans, or some type of a program for higher reimbursement to be able to incentivize them to work with this population that is underserved. So anyways, that's a few thoughts that I had on our practice and how we can help bridge the gap, and hope it helps.